All right, we're back to Medical, Legal, and Ethical Issues, Chapter 3, Part 2 of 2. Crime scenes. A crime scene is a location where a crime has been committed or any place that has evidence relating to a crime that may be found. With the crime scenes, we're going to wait until police department has secured the scene before we enter. EMS's priority is to provide patient care. In other words, to save lives. And sometimes PD forgets this part of the job. They forget what our part of the job is because they're focused in on their part. EMS has an obligation to the patient by helping preserve the evidence that might convict the perpetrator of the violence. You need to be observant of the condition of the scene. How did the exterior appear? Remember, be observant of the conditions of the scene, how the exterior appeared. Remember how you gained access, what you touched in order to get inside. Remain alert for evidence and try not to disturb it. The patient's going to provide you with valuable information. What position was the patient found? What was the condition of the patient's clothing? Was it torn? Were there bullet holes? Were there stab wounds? Cut clothing? What were the injuries? Be observant. Don't touch anything you don't have to touch. Our gloves that we wear can smudge fingerprints. Don't use the phone. Think of last number dialed. Don't use the bathroom. Did the perpetrator use it to clean up? Watch where you step. Don't step in blood because sometimes you just can't help but step into blood. But if you got to remember, if you do, and then you're tracking that blood throughout the house or the apartment or the building, then you've added another set of footprints. And when you cut off a patient's clothing to check for wounds, don't cut through the holes because this is going to destroy ballistics information. Always cut around holes, bullet holes, slashes in clothing. Don't cut through them. Medical examiner cases, the involvement depends on the nature and the scene of death. The examiner, the ME, is usually notified in cases of DOAs or dead on scenes, death without any previous medical care, suicides, violent deaths, motor vehicle collisions where there's death of the occupant. The ME is also notified in cases of poisoning, whether known or suspected, death from automobile accidents or accidents from falls, and suspicions of a criminal act has happened. There are some special mandatory reporting requirements. In Texas, you as an EMS provider are required by law to report violence such as GSWs, gunshot wounds, stabbings, sexual assaults, attempted suicides, child or spousal or elderly abuse, infectious disease exposure. Think about particularly TB, tuberculosis, but now we have COVID going on. And as you can see, there's other special mandatory reporting requirements. Dog bites, assaults, sexual assaults, deceased people. If you're in doubt, report it. Some special situations we may come across. Organ donors. Organ donors have expressed a wish to donate organs. The organ donor is a person who has completed a legal document that allows the donation of organs and tissues in the event of death. Another location can be on the back of the driver's license. And what care is different for an organ donor? None. Because we're just going to begin treatment the same as if you didn't know they were an organ donor. In other words, think of each of your patients as a possible organ donor and do your treatment to the best of your ability. You may come across some medical identification devices, such as bracelets or necklace or a card indicating a DNR order, or they're allergic to some form of medicine. They may have diabetes or epilepsy or other serious conditions. They're unresponsive, unconscious. Always look for medical alert devices. They come on as bracelets, they come as anklets, they come on, they might have it as a necklace, and now they're making them with ink. They're actually having them tattooed on their arms. Lots of times it's down around the wrist area, either on the palm side of the wrist or up on top of the wrist, maybe even on top of the hand. So some other legal aspects that we will deal with: negligence, abandonment, Good Samaritan laws, assault and battery, libel, slander, and defamation. The term negligence is a finding of failure to act properly in a situation in which there was a duty to act, needed care as would reasonably be expected of the EMT and was not provided, and harm was caused to the patient as a result. You're deviating from the accepted standard of care. Something that should have been done wasn't done, or it was done incorrectly. So there's actually four components, not three, four components. You have a duty to act, you breach that duty, which can include a failure to act. You can cause injury or damages were caused, and each of those could be either physical and or psychological. These injuries were a result of the breach of duty by the EMT. First, you have a duty to act. As an EMT, you have a duty to act to the patient. It's an obligation. You have formal duty and implied duty. Formal being contractual obligation between the agency and municipality, and implied duty, the call to 911, beginning care for the patient. So your duty to act is to provide reasonable care and act prudently while you perform your duties. The formal duty, If you're on duty and are dispatched to a call, clearly you have a duty to act, and it must continue through the duration of the call. Sometimes that duty to act isn't too clear. So we have implied duty. If you're off duty, you have no legal obligation to provide care. However, you may feel morally bound to provide care. But one thing to remember under implied duty, if you begin care, you must see it through until you can transfer care to an equal or higher medical training person than yourself. And in general, if you follow your conscience and provide care, you will incur less liability than if you don't act at all. Always follow your local protocol and laws. So the duty to act. Duty to act takes us to breach of duty. The EMT fails to provide the standard of care, breached the duty. The EMT did not provide care as would be expected of an EMT in your area. Or you failed to act at all. Breach of duty. The injuries or damage caused by not providing the standard of care, the EMT caused harm to the patient. This is known as causation. You caused the injury. These damages can either be physical or psychological injuries. All four of the elements, including damages, so that makes it the fourth, the damages, all four of the elements must be present for negligence to apply. You can't just have part of them and then let it go. I want to go back to standard of care, the manner in which the EMT must act or behave when caring for a patient, because your actions are going to be compared to that of another competent EMT. Talk a little bit about a scenario. You and your EMT partner transporting a difficulty breathing patient to the hospital and drive up on an MVC. Do you stop and render aid, or do you continue transporting? What you're going to do, you've got a difficulty breathing, they are stable, so you very well can stop, call it in, and as long as the patient is stable, not in the back of the ambulance with an EMT, you driving may get out and look at the scene, call it in, and stay until the next ambulance gets there and then continue to transport. If the patient is not stable, they're unstable, you would go ahead, call it in, and continue to the hospital. The term abandonment, termination of care of a patient without assuring continuation of care at the same level or higher. Think of it as leaving a patient after care has been initiated and before the care has been transferred to someone with equal or greater medical training. This can happen in the field. It can happen at the hospital. Abandonment. Unilateral termination of care by the EMT without the patient's consent, without making provisions for continuing care. Remember, abandonment can take place at the scene or in the emergency department. You get Mrs. Smith to the hospital, you tell her to sit in a chair in the waiting room, and you turn around to go get another call. You've just abandoned the patient because you have not transferred care to someone with equal or higher training than yourself. Good Samaritan laws. These are laws to provide immunity from liability to people who stop and render aid in an emergency. And it'll only work if the rescuer acts in good faith and does not exceed their scope of practice. It also does not cover acts of gross negligence or other violations of the law. If you reasonably help another person, you're not going to be held liable for error or omission. You must act in good faith, without expectation of compensation, within your scope of training, and you're not going to act in a grossly negligent manner. Once again, once you've started helping this person, you must continue until somebody with equal or higher training certification levels than you have. Gross negligence is conduct that constitutes willful or reckless disregard. And there's another group of laws that grant immunity from liability to official providers, and the laws vary, so consult with your medical director. Assault and battery. Assault being an act that unlawfully places a person in fear of apprehension or immediate bodily harm without their consent, such as kidnapping. Battery, the unlawful touching of another individual without their consent. Now we're back to that consent. You can't just come up on a scene and start treating somebody. You have to get their consent. And remember that patients have a right to refuse care. Defamation, libel, and slander. You do need to know both of these. Libel is the act of injuring a person's character, name, or reputation by false statements made in writing or through mass media with malicious intent or reckless disregard for the falsity of those statements. Slander is the act of injuring a person's character, name, or reputation by false or malicious statements spoken with malicious intent or reckless disregard for the falsity of those statements. Libel's writing, slander is spoken. Mass media, either one, just be very, very careful of what you say and what you write about people. Defamation can happen with false statements on a run report, meaning you did something, you said you did something, but you didn't. Inappropriate comments made during a conversation. Because remember, your patient care report should be accurate, relevant, and factual. We have some ethical responsibilities. Ethics, the philosophy of right and wrong, moral duties, ideal professional behavior, morality, code of conduct affecting character, conduct, and conscience. And then bioethics specifically addresses issues that arise in practice of healthcare. But ethics and morality, in this business, you got to have good ethics and you got to have good morality, because we can be our own worst enemy in this business. Ethical responsibilities require you to evaluate and apply ethical standards, your own and those of the profession. You're going to be in places of business, you're going to be in houses, there's money, there's jewelry, there may be drugs, you name it. It's not yours to take. Be honest in your reporting, keep accurate records. And in the end, as an EMT, you're probably going to end up in court, either as a witness or a defendant, and the case can be civil or criminal. Whenever you're called to testify, your service director will know, and they'll guide you to legal counsel. If you're a witness, remain neutral. You can review the run report before court if it's a call you've been on, but that's the only piece of paper that you can refer back to. So your best defense when called to court is documentation. It's most important safeguard against legal complication. When courts consider an action not recorded was not performed, and incomplete or untidy reports is evidence of poor emergency medical care. This is the end of chapter 3, part 2 of 2. Always remember, do the right thing.